Hey everyone, Dr. Anthony Fauci here. I want you to imagine this for a second. You're 67 years old, feeling pretty good about yourself. Maybe you're reaching for something on a high shelf in your kitchen, and suddenly, your foot catches on absolutely nothing. You're on the ground. And that single fall? It could change your entire life trajectory. Here's what most people don't realize. Falls aren't just minor accidents for seniors. They're actually the leading cause of both fatal and non-fatal trauma in people over 65. We're talking about someone falling every 11 seconds in America. Someone being hospitalized for a fall every 19 seconds. And here's the part that really concerns me as a physician. Most of these falls are completely preventable, but nobody's talking about how. So in the next 25 minutes, I'm going to walk you through exactly why our bodies become more vulnerable to falling as we age. And more importantly, I'm going to share with you the 3 evidence-based strategies that my colleagues and I have seen reverse this risk in our patients. If you're over 65, or if you have parents or grandparents in that age range, you absolutely need to watch this because what you learn could literally save someone's life. Let's get into it. So here's what happens. When you're young, your body is basically a finely tuned machine. Your muscles are responsive, your balance system is working at peak efficiency, your bones are dense and resilient, and your reflexes are quick enough that if you trip, your body automatically corrects. But starting around age 30, we begin losing muscle mass at about 3 to 5% per decade. Most people don't notice this until they're in their 60s because it's been happening gradually for 30 years. Then, around age 65, something shifts. The rate of decline often accelerates, and suddenly, everyday movements that required zero thought become risky. Reaching into a cabinet, walking down the stairs, getting out of the bathtub. These things that you could do without thinking at 40 now require conscious effort and balance. The frustrating part, and this is what I want to emphasize, is that this decline doesn't have to be inevitable. Now, let me break down the actual anatomy of why falls happen. There are 3 main systems in your body that prevent falls. First, there's your musculoskeletal system, which is your muscles and bones. Second, there's your proprioceptive system. This is actually fascinating. Proprioception is your body's ability to know where it is in space without looking. It's like your internal GPS. Your joints, muscles, and skin have sensors that constantly communicate with your brain about your body's position. When proprioception declines, which it does with age, your brain isn't getting accurate information about where your feet are or what angle your ankle is at. Third, there's your vestibular system. This is in your inner ear, and it's responsible for balance and spatial orientation. These 3 systems work together in an incredibly complex dance. When all 3 are functioning well, you can walk on uneven ground, turn your head while walking, or step off a curb without thinking. But when one or more of these systems starts to deteriorate, your risk of falling skyrockets. Here's a startling statistic that really changed how I talk to my patients about this. 1 out of 4 adults aged 65 and older falls each year. 1 in 4. And for those over 80, it's closer to 1 in 3. But here's what's even more concerning. Most people don't fall just once. If you've had a fall, your risk of falling again within the next year increases by about 50%. There's almost a cascade effect. You fall, you get hurt, you become less active, your muscles weaken further, you lose confidence, and then you fall again. It's a vicious cycle that I see all the time. And the consequences are severe. Hip fractures from falls lead to surgery, immobility, and often permanent loss of independence. Falls are also the #1 cause of accidental death in seniors. These aren't minor health events, they're life-altering traumas. Now, before I get to the 3 prevention strategies, I need to talk about why doctors are specifically worried right now. In my 50 years in medicine and public health, I've watched the aging population grow, and simultaneously, I've watched physical activity levels decline. People are sitting more than ever before. They're less active. They're spending more time indoors. There's also an increase in certain medications that affect balance, and we're seeing more cases of vitamin D deficiency, which directly impacts bone density and muscle function. We're also dealing with more people who have chronic conditions like diabetes or arthritis that compound the problem. So the perfect storm is happening. Our population is aging, they're less active, and they're more medicated. That's why we're seeing more falls, more injuries, and more hospitalizations. It's not inevitable though. This is the key point. We know how to prevent most of these falls, and it comes down to these three things. Alright, let me introduce you to what we call the fall prevention triad, and I'm going to start with the first pillar, which is strength training. Now, before you tune out thinking this means going to the gym and lifting heavy weights, hear me out. Strength training for fall prevention is actually quite specific and can be done at home with no equipment. The research is crystal clear on this. People who engage in regular resistance exercise have significantly fewer falls. We're talking about a 20 to 30% reduction in fall risk. Here's why it works. When you strengthen your muscles, particularly in your legs, hips, and core, you're improving your ability to recover from a stumble. You're also improving your bone density, which means if you do fall, you're less likely to break something. The specific exercises that matter most are ones that work your quadriceps, your hamstrings, your glutes, and your core muscles. These are the muscles that stabilize you when you're standing and moving. Now, the good news is that you don't need to spend an hour in the gym. Research shows that just 2 to 3 sessions per week of about 20 to 30 minutes of targeted strength training can make a massive difference. You can do bodyweight exercises like chair squats, where you literally just squat down like you're about to sit in a chair and then stand back up. You can do wall push-ups. You can do step-ups on your stairs. You can use resistance bands, which are incredibly inexpensive and effective. The key is consistency and progression. You want to gradually make the exercises a little bit harder over time as your strength improves. I want to tell you about one of my patients, Mrs. Chen, who came to see me after she'd had 2 falls in 1 year. She was terrified of falling again. We put her on a simple, home-based strength training program. Nothing fancy, just 20 minutes, 3 times a week. 6 months later, she came back and told me she felt like a different person. She had gone from being afraid to walk to her kitchen to actually being able to play with her grandchildren without worry. And the remarkable thing was that she hadn't fallen once in those 6 months. That's what proper strength training can do. Now, the second pillar of fall prevention is balance training and proprioceptive exercise. This is where we're directly addressing that internal GPS system I mentioned earlier. Balance training is fascinating because your body can actually retrain its proprioception at any age. It's not something that's permanently lost, it's something that can be restored with practice. The exercises are simple but incredibly effective. Standing on one leg is probably the most basic one. Start by standing on one leg for 30 seconds while holding on to a counter or the back of a chair. As you improve, you can increase the duration or make it harder by closing your eyes. There's also tandem stance, which is when you stand with one foot directly in front of the other, like you're on a tightrope. There's heel-to-toe walking, where you literally walk in a straight line, one foot in front of the other, like you're walking a tightrope. These might sound simple, but they're incredibly challenging for many people over 65, and they produce rapid improvements in balance. One thing I often recommend is yoga or Tai Chi. Both of these practices are specifically designed to improve balance and body awareness. Research has shown that people who practice Tai Chi regularly have fall rates that are about 50% lower than people who don't. Tai Chi is particularly good because it's slow, it's controlled, you're not at risk of falling while doing it, and it improves strength, balance, and proprioception all at the same time. It's like a triple threat. Even just 30 minutes of Tai Chi 3 times a week can produce measurable improvements in balance and a significant reduction in fall risk. The nice thing about balance training is that you can do it almost anywhere. You can do it while you're brushing your teeth. You can do it while you're waiting for your coffee to brew. You can do it while you're standing in line at the grocery store. It doesn't require any equipment, and it doesn't take a lot of time. Now, here's something that's not always obvious, but is absolutely crucial. The environment you live in has a massive impact on your fall risk. This brings me to the second pillar, which is actually environmental modification. About 80% of falls happen at home, and most of them happen in predictable places and ways. Someone trips over a rug. Someone slips on a wet bathroom floor. Someone doesn't see a step. Someone reaches up too high and loses their balance. The good news is that these are all preventable with some relatively simple modifications. Let me walk you through the most important ones. First, lighting. You would be shocked at how many falls happen because someone couldn't see where they were going. Install bright lights in hallways, bathrooms, and stairways. Consider motion-activated lights in hallways so that if you get up at night, the lights come on automatically. Motion-activated lights have actually been shown to reduce nighttime falls by about 40%. Second, remove tripping hazards. Walk through your home and look at your floors. Are there throw rugs? Remove them or secure them with non-slip tape. Are there electrical cords running across the floor? Move them or secure them to the baseboards. Are there clutter and objects on the floor? Clear them out. This seems obvious, but you'd be amazed how many preventable falls happen because of something as simple as a throw rug or a pile of magazines. Third, install grab bars in critical locations. The bathroom is where falls are most likely to happen because it's wet and slippery. Install grab bars in the shower, next to the toilet, and next to the sink. These should be installed into the studs in the wall, not just the drywall, so they can support your full weight. There are also non-slip mats that you can use in the shower and bathtub. Fourth, improve the stairs. Make sure your stairs are well lit. Install handrails on both sides if possible. Make sure the handrails are sturdy and extend the full length of the stairs, including at the top and bottom. Consider putting glow-in-the-dark tape on the edge of each step so you can see where the steps are. Fifth, ensure adequate furniture and support. Make sure your bed isn't too low, which makes it hard to get out of. Consider getting a bedroom chair that's at an appropriate height and has armrests to help you get up. Make sure kitchen counters are at a comfortable height so you're not reaching too much. Sixth, address any vision problems. Poor vision is a major risk factor for falls. If you wear glasses, make sure your prescription is up to date. If you don't wear glasses but find yourself squinting or having trouble seeing, get your vision checked. We find that many people over 65 have vision problems they're not even aware of. Now, the third pillar of fall prevention, and this is something that I find is often overlooked, is medical optimization. There are actually multiple medical conditions and medications that increase your risk of falling, and many of them are treatable or manageable. For instance, if you have diabetes and your blood sugar is not well controlled, that can affect your balance and increase your fall risk. If you have arthritis in your hip or knee, that can affect your gait and balance. If you have neuropathy, which is nerve damage often seen in diabetics, you can lose feeling in your feet, which makes it hard to maintain balance. If you have Parkinson's disease or other neurological conditions, those can directly affect your balance and gait. Thyroid problems can cause dizziness. Inner ear infections can cause vertigo. So the first step is to make sure your chronic conditions are well controlled. Second is medication review. I can't stress this enough. Many medications increase your fall risk. Beta blockers used for high blood pressure can cause dizziness. Certain antidepressants can affect balance. Sleeping medications can cause confusion and impaired balance, especially if you get up at night. Antihistamines can cause drowsiness. Muscle relaxants can impair coordination. Even over-the-counter medications like cold medicines can increase your fall risk. If you're on multiple medications, your fall risk compounds. The phenomenon is called polypharmacy, and it's a serious issue in seniors. I always tell my patients to bring their medication bottles to their doctor and have a thorough medication review at least once a year. Sometimes just adjusting the dose or timing of a medication or switching to a different medication that doesn't increase fall risk can make a dramatic difference. Third is managing orthostatic hypotension. This is a fancy term for a sudden drop in blood pressure when you stand up. It's incredibly common in older adults and can cause dizziness and falls. One moment you're sitting down, you stand up, and suddenly you feel lightheaded and dizzy. If you experience this, there are things you can do. Stand up more slowly. Before you get out of bed, sit on the edge of the bed for a minute. Before you stand up, sit in a chair for a minute. Stay hydrated. Drink water throughout the day. Increase your salt intake if appropriate. Talk to your doctor about whether certain medications might be causing this. These simple interventions can be incredibly effective. Fourth is addressing vitamin D deficiency. Vitamin D is crucial for bone health, muscle function, and balance. People who have low vitamin D levels have significantly higher fall rates. Studies show that vitamin D supplementation can reduce fall risk by about 20%. Your doctor can check your vitamin D levels with a simple blood test. If you're deficient, supplementation is straightforward and inexpensive. I typically recommend my patients over 65 get a vitamin D level check and supplement if needed. Fifth is ensuring adequate nutrition, particularly protein. Your muscles need protein to maintain their mass and strength. Many older adults don't get enough protein, which accelerates muscle loss. Aim for about 1 to 1.2 grams of protein per kilogram of body weight per day. So if you weigh 150 pounds, which is about 68 kilograms, you'd want about 68 to 82 grams of protein per day. This can come from meat, fish, eggs, dairy, legumes, nuts, and seeds. Adequate protein intake, combined with strength training, creates the perfect environment for maintaining muscle mass as you age. Sixth is hearing assessment. This might seem unrelated, but hearing loss and balance are connected. Your inner ear is involved in both hearing and balance. Studies show that people with untreated hearing loss have higher fall rates. Getting a hearing test and using hearing aids if needed can actually improve your balance and reduce your fall risk. Now, I want to address something that I see in my practice all the time, and that's fear of falling. It's a real phenomenon called fall anxiety or post-fall anxiety. After someone has a fall, they often develop a fear of falling again. This fear can actually become self-fulfilling. They start to avoid activities, they become less active, their muscles weaken, and then they're more likely to fall. It becomes a vicious cycle. If you've experienced a fall, it's important to address this fear psychologically. A physical therapist can help you regain confidence in your balance and mobility. A counselor or therapist can help you work through the anxiety. Don't let fear keep you from doing the activities you need to do to prevent future falls. Let me tell you about a study that really encapsulates how important comprehensive fall prevention is. This was a randomized controlled trial published in the New England Journal of Medicine. They took a group of community-dwelling seniors who were at high risk for falls. Half of them received comprehensive fall prevention, including home assessment and modification, strength training, balance training, vision assessment, and medical optimization. The other half received usual care. After 1 year, the group that received comprehensive fall prevention had a 37% reduction in falls. 37%. That's a huge difference. That's not a marginal improvement, that's a transformative result. Here's what I want you to understand. Falls are not an inevitable part of aging. They're not something you just have to accept. They're preventable. The evidence is overwhelming. People who implement even 2 or 3 of the strategies we've discussed experience significant improvements in their balance, their strength, and their confidence, and they have dramatically fewer falls. Now, I know what some of you might be thinking. Dr. Fauci, this is a lot of information. Where do I even start? Here's what I tell my patients. Start with the low-hanging fruit. If you have a throw rug in your hallway that you trip on, remove it. That takes 5 minutes. Install a bright light in your bathroom if it's dark. Install grab bars in your shower. These are all things you can do this week. Then, start a simple strength and balance program. You don't need to join a gym. You don't need expensive equipment. Just start doing bodyweight exercises at home. Chair squats, wall push-ups, standing on one leg. Start with 15 to 20 minutes, 3 times a week, and build from there. Within 4 weeks, you'll notice a difference. Within 8 weeks, you'll feel stronger and more confident. Then, schedule a comprehensive medical checkup specifically focused on fall risk. Talk to your doctor about your medications, your vision, your hearing, your nutrition, and your vitamin D levels. Have that conversation. Many doctors don't bring up fall risk unless you mention it, so you have to advocate for yourself. The other thing I want to emphasize is that you don't have to do this alone. If you're living with family, involve them. Have them walk through your home with you and help identify fall hazards. If you can afford it, hire someone to do a professional home assessment. Many occupational therapists can do this. If you're living independently but want support, many communities have fall prevention programs. Some gyms and community centers offer classes specifically designed for balance and strength in older adults. Some physical therapists specialize in fall prevention. Reach out and find the resources available to you. Let me also talk about something that's getting more attention in the medical community, and that's the concept of healthy aging. It's not just about preventing disease, it's about maintaining strength, balance, mobility, and independence. Fall prevention is a cornerstone of healthy aging. When you implement the strategies we've discussed, you're not just reducing your fall risk, you're increasing your overall health, your confidence, your independence, and your quality of life. Here's something else I want you to know. It's never too late to start. I've seen people in their 80s and 90s who had become quite frail, who started a strength and balance program, and within months, they were dramatically improved. The human body is remarkably adaptable. Even at advanced ages, muscles can be strengthened, balance can be improved, and proprioception can be retrained. It's not about your age, it's about taking action. Now, if you're watching this and you're under 65, there's actually some great news for you. Prevention is always easier than rehabilitation. If you start now with strength training, balance training, and maintaining good nutrition and activity levels, you can prevent a lot of these problems from developing in the first place. You can essentially buy yourself years of health and independence by taking action now. So let me summarize what we've covered. Falls in people over 65 are incredibly common, they're serious, and they're mostly preventable. The 3 pillars of fall prevention are strength training and muscle maintenance, balance training and proprioceptive exercises, and environmental modification combined with medical optimization. Falls happen because of a decline in muscle strength, balance, and proprioception, but all three of these can be improved with targeted interventions. The evidence shows that comprehensive fall prevention can reduce your fall risk by 30 to 40%. Your home environment is responsible for about 80% of falls, and most of those hazards can be fixed with simple, inexpensive modifications. Medications, medical conditions, vitamin deficiencies, and poor vision can all increase fall risk, and most of these are addressable. Finally, it's never too late to start, and even small improvements in strength and balance translate to significant reductions in fall risk. If you or a loved one has experienced a fall, or if you're concerned about your fall risk, I strongly encourage you to take action. Start this week. Remove a tripping hazard, install a light, do some simple exercises, schedule a doctor's appointment specifically to discuss fall risk. Don't accept falls as an inevitable part of aging, because they're not. You have more control over this than you might think. I want to thank you for watching this far into the video. This information could genuinely save someone's life. If you found this valuable, I'd really appreciate it if you'd subscribe to the channel. We cover practical, evidence-based health information like this all the time. Subscribe and hit the notification bell so you don't miss future videos. Leave a comment below and tell me, have you or a loved one experienced a fall? What's been your biggest challenge with balance or strength? Your comments help me understand what topics you care about, and they help me make better videos. And if you know someone who might benefit from this information, share this video with them. Falls are preventable, and the more people who understand that, the fewer falls we'll have. Thank you so much for watching, and I'll see you in the next video.